A simple trip up the stairs should not leave you wondering why your heart is racing. Yet many people brush this off as getting older or being out of shape. What often goes unnoticed is that carrying extra weight changes how almost every part of your body works. It does not happen overnight. The changes build slowly, often without pain, until your body begins sending signals that are harder to ignore. Hello, I'm Dr. Benjamin. Welcome to this channel. If you enjoy simple, practical health information that helps you understand your body, please subscribe and join our community. My goal is to help you make better health decisions before small problems become serious ones. When most people think about weight, they think about appearance. As a doctor, I think about something different. I think about how much work your body has to do every minute of the day. Every extra kilogram means your heart pumps harder, your joints carry more pressure, and your organs work longer without a break. Your body is incredibly good at adapting, but adaptation has limits. One of the biggest mistakes people make is waiting until they feel sick before paying attention to their weight. The problem is that excess body fat often causes damage quietly. Blood pressure rises without causing pain. Blood sugar climbs before you notice any symptoms. Fat builds around important organs long before you see changes on a medical scan. By the time warning signs appear, the process has often been going on for years. Let's begin with your heart, because it is one of the first organs affected. Your heart acts like a pump. When you carry extra weight, more tissue needs oxygen and nutrients. To meet this demand, your heart pumps more blood with every minute that passes. Over time, this constant extra workload puts stress on the heart muscle. Blood pressure often increases, making the heart work even harder. Eventually, this raises the risk of heart disease, heart failure, irregular heart rhythms, and stroke. This is why you may notice that simple activities become tiring. Walking across a parking lot, climbing stairs, or carrying groceries feels harder than it used to. Many people blame age, but in many cases, the heart is working overtime because it has been carrying more than it was designed to handle. The next place excess weight often causes trouble is your blood vessels. Healthy blood vessels stay flexible, so blood flows smoothly throughout the body. Extra body fat promotes ongoing inflammation. Inflammation is your body's defense system, but when it stays active for too long, it begins damaging healthy tissue. The inside lining of blood vessels becomes less healthy, making it easier for cholesterol to stick and form plaques. These narrow blood vessels reduce blood flow to the heart, brain, and other organs. This helps explain why obesity increases the risk of heart attacks and strokes. The process develops gradually. There is rarely a single day when the problem begins. Instead, small changes continue month after month until blood flow becomes dangerously limited. Your metabolism also changes. Metabolism refers to how your body turns food into energy. Extra fat, especially around the abdomen, makes your cells less responsive to insulin. Insulin is the hormone that helps move sugar from your bloodstream into your cells. When cells stop responding well, sugar remains in the blood. Your pancreas responds by making even more insulin. Eventually, this system struggles to keep up, leading to prediabetes and, in many people, type 2 diabetes. High blood sugar affects far more than energy levels. Over time, it damages nerves, blood vessels, kidneys, eyes, and the heart. Many people are surprised when they learn that weight gain and diabetes are closely connected through this gradual process. Another area many people never think about is the liver. The liver filters harmful substances, processes nutrients, and supports hundreds of chemical reactions every day. When too much fat collects inside the liver, doctors call this fatty liver disease. At first, there may be no symptoms at all. But if fat continues to build, inflammation develops, scar tissue forms. In severe cases, permanent liver damage can occur. The good news is that the liver often responds well when weight is reduced. Even modest weight loss improves liver function in many people because it lowers the amount of fat stored inside the liver itself. Your breathing changes too. Fat around the chest and abdomen limits how freely your lungs expand. During sleep, extra tissue around the neck narrows the airway. This increases the risk of obstructive sleep apnea, a condition where breathing repeatedly stops and starts during the night. Many people with sleep apnea wake up feeling tired even after spending hours in bed. Poor sleep then affects hunger hormones. You feel hungrier the next day, especially for sugary foods and processed snacks. Less energy often leads to less physical activity. This creates a cycle where weight gain and poor sleep continue feeding each other. Your joints also feel the effects. Every step places pressure on your knees, hips, ankles, and lower back. Extra weight multiplies that force thousands of times each day. Cartilage, which acts like a cushion between bones, slowly wears down. As cartilage becomes thinner, joints become painful and stiff. Some people stop walking because of knee pain. Unfortunately, moving less often leads to more weight gain, which increases pressure on those same joints. Breaking this cycle early protects mobility and independence later in life. Many people do not realize excess weight also affects the brain. Blood vessel changes reduce healthy circulation over time. Poor sleep interferes with memory and concentration. Inflammation reaches the brain as well. Together, these factors make it harder to focus, stay mentally sharp, and maintain emotional well-being. Weight also influences hormone balance. Fat tissue is biologically active. It produces hormones and chemical signals that affect appetite, metabolism, inflammation, and reproduction. In men, excess body fat often lowers testosterone levels. Lower testosterone contributes to fatigue, reduced muscle mass, and lower sexual desire. In women, hormone balance changes in different ways, sometimes affecting menstrual cycles and fertility. Around this point, I often think about a conversation I had with a patient who said, "I thought my only problem was my weight." After a routine evaluation, we found high blood pressure, early diabetes, fatty liver disease, and sleep apnea. None of these had caused obvious symptoms yet. That is why regular health checks matter. Sometimes your body is changing long before you feel unwell. Carrying too much weight also weakens physical endurance. Muscles work harder during every movement. You become tired sooner. Everyday tasks require more effort. People sometimes believe exercise is impossible because they get breathless quickly. In reality, breathlessness is often one of the reasons regular movement becomes so important. One pattern I've noticed over the years is that many people underestimate how much a small amount of weight loss improves daily life. They expect dramatic changes before they feel better. Instead, they often notice simple improvements first. Walking becomes easier. They sleep more comfortably. Blood pressure begins improving. Joint discomfort decreases. Small victories often arrive before the number on the scale changes dramatically. Doctors do not evaluate weight by appearance alone. During an assessment, we usually measure body mass index, also called BMI, although BMI is only one tool. We also measure waist size because abdominal fat carries higher health risks. Blood pressure, blood sugar, cholesterol levels, liver function, kidney function, and other laboratory tests help build a clearer picture of your health. Your doctor also asks questions about sleep, physical activity, eating habits, medications, and family history. This helps identify factors contributing to weight gain. Sometimes medical conditions, hormone disorders, or certain medications play a role. Treatment depends on the individual. For many people, the foundation begins with healthier eating patterns. This does not mean starving yourself or following extreme diets. Your body needs steady nutrition. Eating more vegetables, fruits, whole grains, lean protein, beans, healthy fats, and high-fiber foods helps you feel full while reducing excess calories. Portion size matters because even healthy foods contain calories. Eating slowly gives your brain time to recognize fullness. Drinking water instead of sugary drinks removes a major source of unnecessary calories for many people. Physical activity is another key part of treatment because movement changes more than body weight. Exercise improves insulin sensitivity, strengthens the heart, protects muscles, supports joint function, lowers stress, and improves sleep quality. If you have been inactive, begin with short walks or other activities you enjoy. Consistency matters far more than intensity in the beginning. Strength training also deserves attention. Muscle burns more energy than fat, even while resting. Building muscle supports metabolism and makes everyday activities easier. Some people benefit from prescription weight loss medications. These medicines work in different ways, such as helping control appetite or improving feelings of fullness. They are not suitable for everyone, so doctors decide based on your medical history, health conditions, and overall risk. For people with severe obesity and obesity-related illnesses, weight loss surgery becomes an option. Surgery changes how much food the stomach holds and affects hormones involved in hunger. When combined with healthy lifestyle habits, surgery improves diabetes, blood pressure, sleep apnea, and overall quality of life for many patients. Weight loss is rarely about perfection. Many people become discouraged because they expect quick results. Healthy weight reduction usually happens gradually. Slow progress is often easier to maintain than rapid weight loss followed by regain. You also do not need to wait until you reach your ideal weight before seeing health improvements. Research from respected organizations, including the American Heart Association and the Centers for Disease Control and Prevention, shows that losing even a modest amount of body weight improves blood pressure, blood sugar control, cholesterol levels, and overall heart health. Those improvements reduce future health risks because your organs no longer carry the same constant workload. If you notice increasing fatigue, persistent shortness of breath, loud snoring, frequent daytime sleepiness, rising blood pressure, elevated blood sugar, or joint pain that limits daily activities, schedule an evaluation. These symptoms deserve attention because treating the underlying cause early often prevents more serious complications later. The important message is not to fear your weight. The goal is to understand what excess weight is doing inside your body while there is still time to change the outcome. Your body has an impressive ability to recover when you reduce unnecessary stress on your heart, blood vessels, liver, joints, and metabolism. Every healthy meal, every walk, every good night's sleep, and every positive choice gives your body another opportunity to heal. Progress does not depend on being perfect. It depends on making better decisions consistently over time. Thank you for spending these minutes with me. I hope you now understand why excess weight affects far more than appearance and why taking action today protects your health tomorrow. If you found this discussion helpful, please subscribe for more simple, practical, and trustworthy medical education.